Take it away, Doctors Brooke Towner and Heather Vernick.
Awesome. I just want to say again, thanks for joining us. I'm going to go ahead and share my screen. So Heather can lead us off.
All right. So we are again talking about getting outdoors, and this is our interdisciplinary approach to it. So we're going to first start with looking at the evidence to support getting outdoors and being physically active outdoors, and identify our Hope Lab mission, team members, and collaborators, and describe the types of projects and our publications that we have, and the trends and what our next steps are going to be with the Hope Lab. So why do we need to get outdoors? First, we're going to look at spending time in nature and being physically active have shown positive impacts on physical and mental health. And it has benefits for physical activity, such as improving sleep, less anxiety, reducing blood pressure, as well as the long-term benefits are including reducing the risk for depression, weight gain, chronic illness, such as heart disease, strokes, type 2 diabetes, and falls, as well as improving bone strength. And we know outdoor benefits include increasing vitamin D levels, and this is due to the ultraviolet B rays, which enables our body to make vitamin D. And vitamin D production, it has a protective effect against everything from osteoporosis to cancer, depression, and heart attacks and strokes. We also know that getting outdoors is going to increase our physical activity levels, especially if you're a child. Children are more likely to be more physically active if they're outdoors. And it also has shown to increase positive mood. So due to the light being shown, people show or describe that they have elevated moods. Improved concentration. So outdoor exercise has been shown to improve that concentration level. And one study suggested that walking outdoors in green spaces improves concentration greater than those in urban areas. Another thing you might find by getting outdoors is that you can heal faster. Another study showed that spinal patients actually experience less stress, less pain, and need less pain medications when they're exposed to natural light. And you might have better vision from being outdoors. So another study suggested that spending time outdoors helps with crucial eye development, reducing nearsightedness in children. And so we know that people who live in green areas are generally more active and perform greater amounts of physical activity compared to those in urban environments. So with all this information, why do we need the Hope Lab, and what is it, and why is it important? So people are spending an average of 90% of their time indoors. And specifically in the Appalachian region, we're seeing a higher percentage of heart disease, chronic medical conditions, and suicide. As well as spending time indoors is associated with decreased physical activity and increased sedentary activities. And a sedentary lifestyle is correlated with a higher rate of chronic medical conditions such as heart disease, diabetes, cancers, mental health issues, and much more. And so chronic diseases are associated with a lack of physical activity, and that costs the U.S. health system about $117 billion a year. And 1 to 2 people are living with a chronic illness as an adult, and only about half of them are getting the physical activity that they need. And so physical activity levels are dependent on the availability of the green space and safe outdoor spaces. It's also increased by or influenced by increased screen time and other environmental factors. So for example, if they have a lack of sidewalks in an area, someone's physical activity levels might be limited, as well as their ability to feel safe in that environment. So likewise, convenience and accessibility to recreational facilities such as parks have been associated with higher levels of walking. So therefore, if the Hope Lab can increase the awareness and improve access to outdoor spaces, we can positively influence these issues. And now I'm going to turn it over to Brooke.
So really, in light of these problems, what we're seeing is that these healthcare providers are being encouraged to now ask their patients about physical activity habits, and coupling that with prescribing outdoor physical activity across the country and internationally. And we've also seen some professional organizations get on board, like this policy statement from the American Public Health Association, where it's asking these health professionals to not only advise patients, but also the public about these benefits of getting out and getting in these green spaces. And I think one of the cool pieces of this policy statement is that they're also calling for alliances to be formed. So we're moving from kind of silo thinking and getting outside those silos and forming alliances with parks departments, departments of planning and design. We're looking at aging agencies, green and gardening organizations, extension services, school districts, nature centers, and really increasing those accesses to green spaces where people live, work, and play, and raising that awareness. And so getting on board, the American Academy of Pediatrics president actually in 2019 stated that one of his priorities is to connect children and families with nature, as well as exercise is medicine, which is an American College of Sports Medicine initiative, has become partners with Park RX America, which works to prescribe outdoor physical activity to patients. And what I think I see and what I see in this policy statement is that these Beaver College of Health Science departments are really well represented in this public health statement. And really, in a nutshell, what research is saying is we see 120 minutes a week of exposure to nature has significant benefits. And coupling that with the recommendation of 150 minutes of physical activity, we can really merge these two and promote physical activity outside as a Hope Lab goal and have people really take their health to new heights. And so that leads us into what really is the Hope Lab. And our goal of the Hope Lab is to promote, support outdoor physical activity, exercise, and play. And we're an interdisciplinary team here. And we have a couple founding members, Richard Christiana, Rebecca Batista, and Joy James from public health, exercise science, and recreation management. And over the last few years, they've added a few disciplines and added a few researchers to the team, which has been really cool because one of the values of the Hope Lab is kind of that mentorship as well as collaboration across disciplines. And we see that those values present too with our students. We have undergraduate students working with us. We have graduate students working with us from multiple disciplines: exercise science, public health, social work, recreation management, and physical education. And that's really a huge piece of what we do, as well as creating these collaborations and partnerships that have been built. We want our focus for the Hope Lab is to form sustainable partnerships, to examine outdoor physical activity and really look at the benefits of outdoor physical activity and get more people active outdoors to promote not only physical health, but well-being. So working from an interdisciplinary perspective, our goal in these collaborations is to really identify strengths and barriers, interventions related to physical activity, the individual, the family, the school system, the neighborhood, the community, from a local and a national policy perspective, really utilizing that social ecological model. And not only do we feel like we're well represented across disciplines within ourselves, but we've worked creatively with other collaborators. And a few of those are, you can see Park RX America. We worked with them to develop a resource to parks and trails within the high country. We've, like most people, when they've had to flip-flop their research with COVID, we were fortunate enough to work with Kansas State and Gina Bassini from the Exercise Behavioral Science Program and develop a physical activity and COVID survey from her base survey. We've worked with the University of Tennessee on research presentations related to outdoors and children, the College of William and Mary, and how they've introduced us to really encouraging peer-to-peer park prescriptions within our campus. And we've done a few projects with that. We worked with track trails, and I love it to further understand and promote kids in parks and the track trails located within the Carolinas, North and South. And so with those collaborators, Heather is going to kick us off by highlighting some of the projects that we've done and some of the collaborators that we've worked with.
So one of our first projects we did was prescribing outdoor physical activity. And we have a couple other publications here that you can see. But this project first was a pilot study created by Joy James, Becky Batista, and Rich Christiana. And this study looked at pediatrician prescriptions for outdoor physical activity among children. And they collaborated again with the Kids in Parks and the Blue Ridge Pediatrics to prescribe track trails to those children. And the outcome of this study was that 44% of the parents believed that the prescription encouraged their child to get outdoors more. However, it didn't have a significant effect on their increase in physical activity. And this is leading us to our future studies that we have. Next slide. With track trails and track RX. As you can see over here, I have a picture of track trails, and this is a project led by Rich Christiana and partnered with the Kids in Parks with Jason Uroza, and it's to create more sustainable track trail locations. You can see that most of them are in the North Carolina, South Carolina, Virginia area, but we are expanding, or they are expanding further into the rest of the United States. So we're trying to create more sustainable track trail locations. And then our other project here is Track RX. And so we're building off that previous project, and this includes Rich, Jason, Robert Gross, and Becky and myself. And we're looking at more factors that are affected by outdoors and physical activity, such as sleep, mood, and concentration of the children as reported by their parents, and a before and after survey before and after they receive that Track RX. And the goals are to see if the Track RX increases the likelihood of the child and the family to utilize track trails. Also, is getting outside going to increase their mood, improve their sleep, and increase their concentration levels, according to the parents' report. And lastly, to see if the Track RX increases parent-child motivation to spend more time outdoors and or increase, the motivation to spend the time in physical activity. And I'm going to turn it back over to Brooke for some more projects.
Like I said previously, we all had to get a little creative with our research during COVID. So these are some of the shifts, the pivots that the Hope Lab made as a team. The first project we want to highlight that focuses on COVID is this physical distancing on trails. Rich, Christiana, Heather, Robert, I feel like we all had a hand setting up some type of video camera when we were on this project, but the aim was to really examine how trail users were adhering to physical distancing guidelines. And we collaborated with some other departments, or people from other departments here, Elizabeth Shea in geography and Adam Hagee in public health, as well as West Virginia University. And their policy department, their public health department, and their landscape evaluating department. I forget exactly the technical name of that department, but the idea here was that we used video capture on the trail pre and post to look at trail users' habits. So there were 30-second motion activated bursts, which we then analyzed pre-intervention, and then we laid down some stencils that said, hey, this is 6 feet. And then we did a post-intervention to evaluate physical distancing. And really the main takeaway was that because especially here in Boone, the trail is wide enough to maintain that distance. But I think the new or the novel piece was in this particular study, we used a new way to measure distance through video capture, whereas previous studies have used algorithms or were actually on location for observation and measurement, which was kind of neat. And then another project we did over COVID was this physical activity and COVID survey. And the objective here was to examine changes in physical activity before COVID-19 and during COVID-19 for families, for parents and children. And with that, team members that led up this one were Rebecca Batista and Robert Brooke, as well as myself. And we used a survey this time and looked at types of physical activity, locations where outdoor physical activity or physical activity took place, amount of physical activity, as well as mental and physical health factors. And our collaborator on this one was Gina Bassini, again from Kansas State University. And the main takeaway was parents fared better than their children during COVID. And I think that parents just found ways to maintain or increase physical activity. Parents' physical activity level remained consistent during COVID-19, and over half achieved 30 minutes of physical activity a day. What the big change was is that about 65% of it did it at home, whereas almost 50% of children showed a decrease in physical activity. And less time was spent in those recreational sports, those fitness facilities, and physical education. Because of the closures, whereas home-based physical activity did increase there. So I think that these projects just give a real highlight to what the Hope Lab is about and the mission of promoting and supporting outdoor physical activity and investigating in that area. And what we're moving towards are these trends. These trends are, I think, speak most to the work that the Hope Lab is built off of. And we can use these trends as a jumping off point as far as the benefits of nature and exposure to nature is concerned. So thinking about that link between experience in the natural world and our health physically and emotionally, looking to understand that link to nature and well-being. We've done some work in this area for number 3 with the healthcare providers getting more involved in prescriptions. And then we're heading in this direction where we're looking for educators and schools to get into to really evaluate those benefits of nature-enriched schools. Looking from the grassroots and that policy canopy, exercise as medicine is on campus, and we see some really awesome opportunities to collaborate there with the Hope Lab and promoting physical activity in the outdoor setting. And again, coming back to that children piece, which I think was the heart of the Hope Lab as they started, really looking at children, but we've expanded that population. And so as these trends move towards more holistic system approaches, and we want to involve disciplines and we want to engage stakeholders, these really provide that jumping off point for our next step. And in closing, we really the Hope Lab wants to continue working with the Appalachian community to investigate the role of outdoor physical activity on health, on the environment, and on human development. And that's really the center of Hope Lab's purpose. And it's through each of these projects and these collaborations that we really learn new concepts, that we raise new questions, and that we're able to really develop ideas for those next steps. And so I want to thank you for attending our presentation today, and I'll turn it over to you for questions if you have any. You can, I guess, unmute or throw them up in the chat, and Heather and I can go back and forth on answering those.
Hey, Brooke, I've got a question for one of your talks. You were talking about alliances with nurse practitioners, doctors, etc., about advising patients to get outside, kind of prescribing exercise. Is there any indication that insurance companies might jump on board and help, maybe fund research or fund ways for patients to get healthy? Because I think it's in their benefit. And if we could get insurance companies on board, that would help a lot.
Matt, I really like your thinking, and I'm going to turn it over to Heather for this one.
They're actually working with kids in parks now with Blue Cross Blue Shield and helping fund some of those track trails, as well as they're working to see if they can get the prescription part to be part of the EMR, which is the electronic medical record, so that there's like a direct referral to the kids in parks. So there's a couple different ways where the insurance companies are stepping on board with it. I definitely think there's a lot more that they can do, and they can make a lot more improvements, but there are small steps in that right direction.
All right. Excellent. Thank you.
Thank you.
Oh, go ahead.
So I can just chime in and Matt tell you that the FIT bill is moving forward. Can't remember if it's at the House or it passed one of them lately, but that is where I think it's going to benefit us in exercise physiology and promoting physical activity, where going to a fitness center is going to be paid for by insurance. So I think we're getting there. This has been a pretty popular prescribing, EIM is really gaining some ground, and the Park RX is really gaining ground. So I give it a couple more years and we'll see more and more of it.
Yeah, excellent. Good, thanks.
Thank you, Becky.
So in the chat, we have a question. Do you think lack of personal interaction with others would explain why young people were more affected than adults who would at least work virtually and interact with different people, albeit virtually and not physically? And I think you're on the right track, Michael. And that's some of the things that we discussed in our manuscript, is that while adults were able to kind of carry on with their normal routine, is like school did not look anywhere normal from what a regular in-person school day was. As a parent of kindergartner, first grader during COVID, it was a completely different scene. And so those are some of the things that we included in that discussion, is that they didn't have that personal interaction, and they were just kind of tagging along with their parents if we went outdoors for physical activity or play or yard work.
I have a question about something that you showed. I couldn't quite catch it, but there was in some of the prescriptions, there was an aspect of adventure. Was there adventure cards that they,
Oh, yep.
one of the studies, and I was intrigued by that because, I can walk for hours in nature for 3, 4, 5 hours, but my son, after 15 minutes, he's bored out of his mind. So some aspect of play, I guess the adventure cards would introduce that. And I was wondering if you could comment on how popular those were with the kids when you were using them.
I think you're talking about the track trails part, correct? And it's actually really neat. They have little pamphlets at the different track trail locations, and it has anywhere from like physical activities that they can do, but more so the like connecting the nature part to the activity. So there's one at it's not Price Lake, but the lake up there where you can paddleboard and kayak and things like that around this area. And it has like, go look at this flower, and it talks about that particular flower and things like that. So it really connects the learning aspect to the nature and helps them stay engaged, like you were saying, because their attention span is really short. And so if you're not doing something active, keeping the mind and the body together, it sometimes is hard to keep the kids, motivated. So I really like that aspect. And there's a reward system too with the track trails. So they'll send them a little like gift once they do the first one and log it. So that's a really neat way to kind of reward them for that positive activity.
I've got one more, kind of a follow-up. What is the age group that you were working with? Maybe you've mentioned it, but I might have missed it.
So you're talking about for the track trails. So I think for the track trails that it can be a wide range, but the pamphlets and things are geared to like 4 to 14-year-olds. And so for our Track RX program, that's what we're aiming to look at is 4-year-olds to 14-year-olds. Because of the types of activities there, it might not be as interesting for older kids, and it might be a little too advanced for the younger preschool or toddler age. So 4 to 14 is what we're gearing that particular project to.
I have a question about parents and engaging with the child and their physician and the RX program. So have you guys looked at the effect that parents' physical activity has on the kids' willingness to engage with outdoor physical activity as well? I imagine that would sort of be related in some way, but I wonder if you looked into that data or if that's something you collected.
So we're still working on the Track RX, and I might ask Becky Batista here to comment on the Park RX part. But I do know when we've been discussing this that actually leading by example for the parents isn't necessarily going to indicate a higher level of physical activity in the children. Whereas like nutrition, like it goes hand in hand. The better the parent's eating, the more likely the child's going to eat a better meal. So I might ask Becky just to further that comment though.
No, that's absolutely correct. We wrote a paper about this with the undergrad about 2 years ago. And surprisingly, we did find out that there really is no role modeling of the parent and the child's physical activity, which is kind of not what you would think would happen. But active parent doesn't necessarily mean the kids are going to be active. And sometimes the parents aren't active, but the kids are active. So we're not really sure why that is, but it kind of came out to be that way. So the hope of the prescription stuff is we also are asking the parents a lot of information because the parents are a gatekeeper to the kid, and you kind of have to have that aspect of it too. So we'll see. We're not really sure what's going to happen with it.
And the last thing I was going to add is I think that's the big part that I was hoping for with the Track RX is that they're going to be more motivated to motivate their children. So hopefully that's like a third goal of that project.
That's interesting. Thank you.
Does anyone have any additional questions? We might have time for one more. If not, we can wrap up this interesting and engaging presentation today. I'll give people one more minute if they'd like. All right, then I'm not hearing it moving forward. So thank you to Brooke Towner and Heather Vernick and the Hope Lab for this presentation. And thank you for attending the session of the Research and Creative Activity at Appalachian Events 2021. And don't forget to visit the event website in the link that was shared in the chat for all other available sessions this week, research posters and recordings if you can't attend live. So everybody have a great week and thank you for attending.
Get outdoors, enjoy the sunshine.
Thank
Bye,
you.
y'all.